Welcome back, everybody. I hope you're refreshed after the break and ready for our next session. Now we're going to look at the Aviation Health Safety Protocol. This was a document which we produced together with our sister agency, ECDC, the European Centre for Disease Control and Protection, and we published that in May this year. It was really the one development, I think, which allowed operations to get back to some degree of normal after the terrible dent that was put into operations by COVID. We're going to be using Slido once again during this panel, so I would remind you that you can either submit questions by putting them on the screen when that is available, or you can use it on your mobile phone or any other device by visiting slido.com. The code for our particular event is #ASC1. Thank you very much. I'm now going to hand over to our Head of Safety Operations, John Franklin.
Good afternoon, everybody. So we've talked now in the first panel about safe and effective operations. But now for this second panel, we're going to focus on the challenges we have welcoming our passengers back to the industry, back to flying, through the Aviation Health Safety Protocol and the different measures that we have, so that passengers start to regain their confidence in booking tickets and coming back to our industry. We have an ever-changing situation in terms of coronavirus at the moment. There are lots of changing dynamics in terms of how things are evolving. And passengers naturally have a fear about what they can and can't do, how they can book, where they can travel. And in this panel, we bring together some key industry experts to discuss how we can evolve with the health safety challenges that we have over the coming months, and really create that positive feeling for our passengers and create the enablers to help the situation improve and develop. The first two panel members come from ECDC on the health side from that agency and from EASA. So we have Josep Jansa, who's the acting head of emergency preparedness and response support at ECDC, and from EASA, Luc Tytgat, who's our Director of Strategy and Safety Management. We have representative from the airline side through Stanislav Bukhman, who's the head of Group Safety, Security and Compliance at Wizz, and ideally placed to give us the airline view on the situation. And then from the airport side, we have Ivan Bassato, who's the Director of Airport Management at Aeroporti de Roma, where they've been doing so many things to support the safe passage of passengers during these tough times. So we're going to start by asking a question to our panelists about the barriers there are to passenger confidence. We know that passengers are hesitant to fly. On the one hand, there are ever-changing policies that mean they might be stuck in quarantine at the destination, or also when they return home and are trying to get back to work and all of these other things. Passengers also have a concern from the health side. Are they safe to fly? Are they at risk of the virus whilst they're on their airport and going to the airport and traveling on an aeroplane? So how can we combat this perception as an industry? And this is the first question that we're going to tackle. And I'd like to start by turning to Josep. So from the health side of things, Josep, there are lots of things that we've seen in the news and on social media about aviation and COVID and the health risks. What's the view from your side of things?
Well, so far, as all of you are aware, we have been learning by doing. So we started from not knowing what was that about and have to build knowledge, of course. That knowledge has been built on previous experience, on other situations, on other guidance, on other viruses that we have knowledge, and interventions that we have prepared for those situations, like those that we have included in what we call the RAGIDA guidelines, that is Rapid Advice Guidance for Aviation. So then I think the good thing that time is that we have had the opportunity to work very closely with EASA in terms of preparing the first document on COVID-19 aviation health safety protocol, from which different versions have already been updated. And we have continued working very closely with the guidance on border merchants for air travel, also on the considerations in terms of passenger locator. And we continue working in a very close and efficient cooperation, which I think is the way through in terms of to be in the best side to control and to deal with that situation that is always unexpected and always challenging for all of us.
Thanks for that, Josep. And it's been great as somebody from the EASA side being actively involved in that collaboration. It's been fantastic to see, the way our two agencies have worked together. Now, if I turn to you, Luc, I know there's a lot of work that's gone into coordinating the aviation health safety protocol. So what's your view on the success of this?
Thank you, John. Maybe there is another question first to be raised is why EASA did invest into health. In fact, the reason has been that on safety, a lot of methodology, a lot of methods, a lot of practices have been seen as successful in view of improving the safety of air transport. And all those tools, methodologies have been applied to deal with the health risks. And health was seen as a new risk for aviation safety. So that's the first reason. We try to use the current tools and methodologies. There is another element which is very important that, of course, we didn't have the full expertise in science related to health and COVID-19. That's why that's the second key to success. This partnership Joseph was explaining with ECDC, with our sister agency, has been so much profitable. We have been able to build up together real time when drafting the protocol as requested by the European Commission, is to build up a document which would be seen at the same time by the health authorities, the health sector, and the aviation authorities, the aviation sector. So those two angles were very important to be reconciled in the protocol, and it's what we successfully did. Another element key to success is the fact that we have been able to also embrace the whole aviation industry, the whole chain, if you want, from the entering into the airport up to the luggage area. I mean, including, of course, how to deal with the shops and restaurants in the airport, boarding on the plane, and of course also for the crews. So we had to tackle all the elements related to the air transport industry in order to be seen on the aviation sector as really dealing with the risk for the full travel and the full risk we have to encounter. So that's, I would say, the elements I would say is very relevant to this.
Thanks, Luc. And now perhaps if we can turn to you, Stanislav, from an airline perspective, what are your customers telling you about their biggest fears? How has the pandemic changed your approach as an airline to the onboard experience?
Hello, everybody. Well, first of all, I would like to start from the fact that I don't think that our passengers are afraid to fly, or they have any major concern of flying itself or being on board itself. In fact, the aircraft is a very clean environment due to well-known, now at least well-known facts that it's equipped with the HEPA filter, and the air is circulating and being refreshed and cleaned every 2 minutes, and the air recirculation is going from top to bottom, meaning it suppresses all the bacteria, viruses, the downside of the aircraft. And the airports are equally clean now with all the health and safety measures. And the clean aircraft, by the way, in the way that EASA together with the ECDC suggested us to do so. So aircraft itself is clean, and we really don't think that passengers are afraid of flying. And our figures show that as much as we could fly in summer, we had a full aircraft and we were flying almost the full capacity. And now when the limitations were put back in place by various states, we have a lot of aircraft on the ground. So we think what prevents passengers from flying is the restrictions and limitations imposed by the state, and certain unpredictability of these passengers are rather worried to stuck somewhere in the quarantine or to get their flight canceled and then get into the, rebooking the flight or getting their compensation rather than from the flight itself. Still, there is no proven case of the COVID transmission on board, which also is working for us, let's say. And still, we think that to go to the supermarket is more dangerous than to fly an aircraft. As a matter of fact, we had a focus flight with one of our network airports under EASA's guidelines. We were testing EASA protocols. So the flight was monitored by the regulator on the one side of the destination and on a region, and on board we were monitoring this flight as well. And we used this flight as a case study, and we did a survey on this flight. We surveyed our passengers on how do they like our safety measure and how safe they think the flight is. And we got a very positive result, which made us even more confident that as soon as the limitations will be removed, we will have again full aircraft and we will fly our full capacity.
Thank you for that. And it's interesting from a personal perspective. I've flown a number of times during this pandemic with a number of different airlines, and it's been interesting to be involved in the health safety protocol and see some of these measures in action. And it was interesting to even be on a flight personally myself and seeing passengers who I guess expected a negative experience and were really pleased to see the opposite, and finding that they felt safe and protected. And I think certainly from I know from a lot of people, friends I have, I think many of us find the same, is that people make emotional decisions as well as practical ones, and these kinds of measures that you talk about are really great at, hopefully people, they take a flight, they have a positive experience, and they tell their friends that it was good and they would fly again, and that spreads that message and creates that kind of positive emotion. So if we turn now to you, Ivan, from an airport perspective, I know you've been doing an awful lot of things. There's been lots of different activities. So can you tell us some more about how you've evolved the passenger experience at your airports during the time of the pandemic?
Thank you, John. Good afternoon, everybody. Since the beginning of the pandemic, everything that we have done was aimed at creating and communicating the idea of a safe airport environment, a safe aviation environment. So we implemented a broad scope of measures of protection and prevention, and it was clearly the aviation health safety protocol one of the pillar of this plan. Since the beginning, we signed the protocol charter with the EASA very early in the process, early June, and we ran through a series of approval by certification entities. In June, we were the first airport to receive a biosafety certification from an international body. In August, we were accredited by ACI Europe according to the Airport Health Safety Program, and in September we were the first airport in the world to receive a rating in COVID response of 5-star by Skytrax, and we are still the sole airport in the world to have such a rating. We won't stay the only one for long, but this is the status in the last 2 months. Roma Fiumicino is a very different airport than nowadays. We implemented a lot of technologies for thermal screening, for sanitization, very specific, very detailed sanitization procedures, of course, social distancing, strict procedures for that, separation screens, and everything that is recommended in the protocol. I had to say that the protocol of EASA and the ECDC was really a very useful document. We can say many good things about that protocol. It came in a timely manner right after the lockdown. It is a clear, well-structured, broad scope document, easy to navigate, suitable for developing gap analysis. It did really put aviation ahead of other means of transportation in cooperation together in conjunctions with the national regulations that were in any case less stable than the protocol. There are a few things that can be done to improve the experience of the charter, but I would say that 95% of the objectives were actually obtained. So we ran a survey in September. We interviewed our passengers, and we came out with the result that the passengers are really, those that already came back, are really trusting aviation as a sector that provides superior health safety standards. 99% of the passengers surveyed said that they believe themselves in a safe environment, in the airport and along the trip. And if we go to a comparison with the day-to-day life of people, Fiumicino, according to these passengers, was rated well above or over the safety levels of the other environments in almost the 95% of the cases. So we created and communicated, in our view, a safe airport environment, a safe aviation environment. The problem is that it seems not to be enough from the traffic figures perspective.
And I think this really starts to move the discussion towards some of the kind of the heart of some of the challenges that we have. And I think one of the things that the answers and the discussion at that first point really highlights is that the aviation health safety protocol provided an excellent framework and an excellent foundation on which we could build as an industry to set that common standard to enable passengers to have a level of confidence in terms of what they could expect as passengers during a time of such uncertainty. And I think, it's that, again, I continually come back to the emotional element of this, is that, because we created an element of emotional certainty with the measures through the airport, we see the discussion now not so much about, people being concerned about catching COVID-19 during their flight and during their journey. There are other questions, which kind of leads us quite nicely into now two directions. And for the second question, I'd like perhaps briefly even to go into the first side. And I know there'll probably, and we've seen already, there are a few questions about testing, and we'll come to that as the third part of the question. But particularly, obviously, we've seen some evolution in the pandemic, an evolution in the situation. Obviously, it has evolved across Europe and the world. So for the second question, again, I come first to Josep. How do you see the need to further integrate the health safety protocols so we can both limit the spread of the virus as it stands now, reassure the public, and then kind of manage the situation as we perhaps see it changing into 2021 from that period? Josep.
Thank you for the question. I think that once the protocols are being refined and evolving in the right direction, because as mentioned before, this is a changing environment and in a very dynamic situation. We need to keep going with those healthy protocols to see what measures are the best ones, and we are learning from that. So as time's passing by, we better understand what is working and what can be maybe taken out. In order to understand also the safety environment in flying, and I'm talking from the health perspective of an agency, one indicator I think that can show us that maybe this is, or probably this is a safe environment, is that so far very few outbreaks and cases have been reported occurring in flights. And of course, it's difficult sometimes to see if that has happened during the flight, when boarding, or when leaving the plane. But nonetheless, it was one article that was published this summer from an outbreak in Ireland, where there were some cases that, of course, they were happening in other places because there is the chains of transmission are happening here and there. But what we know is this is quite an exception. And in such an environment where the virus is widespread within the community, we need to take into account that aviation is not a risk per se. It's something that we need to consider within many other environments, and the same measures that apply in our daily lives have to apply in flights, that have to apply when we travel, either with a plane, or with a train, with car, or with whatever means of transportation. So again, our message in ECDC, and this is the way we are working, as mentioned before, very closely and very nicely with EASA, is to be consistent with our statements, to be coherent with our statements, and not to change the advice. So because of that's what will keep trust in our passengers and in our general population, and that's what will allow us to continue working in that direction in the best possible way. Just to finish that, one of the good things that I mentioned is the need to permanently follow the new developments in this field. Because as you can imagine, there are hundreds of thousands of scientific articles that have been published here and there related to all the different aspects of that virus. The transmission, the essence of the virus, the infectivity, the ways to protect, and this continues to go forward. As you know, at the very beginning, the main international agencies like WHO or ECDC and others were quite skeptical of the added value of using face masks. But later on, when aerosolization was clearly identified as a way of transmission, then a part of the droplets, face masks take a more important role. And now that's quite extended and quite implemented in all the flights without major problems. Just to say, to summarize, that whatever it comes, we will take that into account, and together with EASA and other partners, we will address that in the best possible way.
Thank you, Josep. I think that summed up the situation fantastically. And maybe if I now turn to Luc from the aviation specific side, how do you see the evolution of the health safety protocol and the health safety measures?
I mean, the news from ECDC are excellent. I mean, we have been said this afternoon that traveling by air is safe from this virus perspective. So what we could say, one could say we have done our job, certainly not. What we have to ensure that this protocol is compliant with the evolution of the technologies and the detection, prevention. So we have to be sure that this protocol is something which will continue to be updated to match with the reality. The second element is to ensure that the news are continue to be good, that we have an harmonized implementation of the protocol across all European states. We have a single market in air transport. I mean, this single market must benefit from this harmonized implementation of the protocol. It's not yet completely the case. That's maybe something we realize in the aviation from the regulatory perspective, is that we don't see an harmonized implementation. And that's why we were obliged to set up a monitoring group with national regulators for aviation and health authorities and ECDC to monitor what the operators are reporting from the field. So we signed a lot of charters, I think with 70 airlines or something like that, covering half of the traffic in Europe, which is confirming that there is good result, but still progress to be made. That's part of the equation. And there is maybe another element, I would say, that there are the need to have a PLC, a person locator card, to be Europeanized and digitalized in order to get the travel experience of the passengers a bit nicer than it is today. And last point, John, is the international dimension. When we speak from the European market, intra-Europe, air transport is a global industry. And I think what we want to do now at EASA is to promote the experience we have in Europe, outside Europe, in particular with ICAO, which is going on, but also in Southeast Asia, in Latin America, where they are trying to learn from us what has been this partnership between health authorities and aviation authorities to build up a response to that crisis.
Thanks, Luc. I think that's one of the things as we see the situation evolve, is that we have first of all the coordination within the European market, and through the strong international relations and activities that have been going on for many years, we have those partnerships to forge those international partnerships and activities and strengthen the wider outreach of both the protocol and the measures, and then coordinating on a wider industry perspective. So Stanislav, perhaps if I can turn to you now from an airline perspective, how do you see, just from the health safety measures at this stage, how do you see things potentially evolving from your side as an airline?
I will be very short here, and I would like rather to reflect what Luc just mentioned. We think that the measures are already robust enough, and from the airline perspective, we do not see much room for the improvement at this moment of time. Obviously, there can be some minor changes. The situation is developing. There may be new learnings about the virus. There may be new guidelines on the substances that clean aircraft and better kill the virus. But not something principal. I think what is important, and this is to achieve as maximum as possible the synchronization between the health safety measures from state to state. So exactly what Luc mentioned, in the European market, the measures should be equally. And in the wider perspective, as much as we can reach our worldwide partners, the measures should be equal around the globe. It will remove a lot of complexity and will ease the travel of the passengers as much as possible.
Thanks for that, Stanislav. And it's nice to see that there's been so much done already, and although it's a continually evolving situation, we have so many things in place already that kind of provides that solid foundation we've been talking about throughout. So now, if I can turn to you, Ivan, from the airport side, how do you see things evolving from your side? I know, I've seen there's been lots of different technological solutions. It's been amazing to see so much innovation, particularly within the airport environment, taking place. And you've been at the heart of that. What's the view from your side as an airport?
Well, John, I think also that the protocol is very robust, can always be improved, better standardization, better exchange among airlines and airports. Honestly, a huge majority of our customers, our passengers, feel safe inside our airport, and technology played a key part. It is really at the core of the plan that we implemented. Nevertheless, if we ask passengers, are we going to fly again soon in the next months, a very limited amount is planning actually to fly again in the first part of 2021. And why is that? For two main reasons. Almost all passengers say that there is no safe destinations. Where should we go? Okay, so there is a feeling that even if they travel, there are no places where they could really stay safe. And this is very much connected to the pandemic trends. I don't think the aviation can do a lot about that, rather than continuing to implement very seriously the measures foreseen in the protocol. But on the other hand, there are a lot of passengers that are complaining about the uncertainties that they had to face in terms of quarantines, in terms of restrictions that change from country to country. Almost 80% of the passengers are saying, we do not understand what the measures are. Okay, so we need something, a viable, safe alternative to a system that is not harmonized and it is not understood by the passengers, and it is contributing to fueling a feeling of lack of safety in general, not in the aviation, not in the airport. So it's a kind of paradox. So on one side, we have passengers that are very satisfied about the results that we have achieved in terms of protection and prevention measures within aviation. On the other side, we have passengers that are sanguine about the future.
Thanks, and I think that leads quite nicely from what we've heard from all four panelists there. It's kind of leading to this third big question that I know that the audience is likely to be of the most interest to them, or the most interesting talking point. The way things stand at the moment, and that's turning to the subject of testing. So for the third question, and we kind of leave the longest time for this, I think it's probably quite important, the question is really, is testing the answer? I think we've come to the situation where it looks like it's one part of a multifaceted approach to health safety, with the health safety protocol at its foundation, with testing and the standardization of measures and all of these things then being kind of the next step for us. So if I start perhaps with Josep, what's your view around testing and the aviation environment? Has the technology for testing evolved to provide the scale and the speed that you think the aviation system needs in order to be able to implement this?
Yes, as we mentioned in the last document that it's in the considerations on border measures and air travel in the context of COVID-19 that has been published together with EASA. We clearly say there that testing now it's appropriate for suspect cases, only in those situations, but not massive screening test has to be advised. And this relates also to what Ivan mentioned before. We need to consider and clearly come with the measures when there is enough evidence to keep trust again with the passengers. Also, we need to take into account that testing, the rapid antigen test, that is the approach that has been discussed, and it's still being discussed, not only in aviation, but all over. As you know, there are countries that have implemented now within the EU massive testing in their populations, as Slovakia, that did that to all their population. And the results there at less than 1% of positiveness from those results, which means that it's difficult to understand what does that mean in terms of the achievement. So then testing currently is not the way through in terms of the aviation, as it is not the systematic quarantine as it was been discussed here and there. Also following what Luc mentioned before, passenger located forms is the way that it's been implemented, and it has to be kept in order to identify possible suspect cases, possible infections, and then in that particular case, put the appropriate measures in terms of testing, in terms of quarantine, but only in those situations, not as a way of screening, not as a way where all the systematically all passengers have to go through. Finally, we need to take also into account that the prevalence, which means the number of cases that are in the population, how much population is infected, the passengers are a subgroup that we can consider healthier than the average, because if you don't feel fine, you are discouraged to travel and you don't take the initiative to travel. Overall, of course, there are exceptions for everything, every time and everywhere. But in general terms, this is a group of citizens, a group of individuals, not only in the EU and the EA space, but all over the world, that they feel fine and they are healthier. And there are other examples for that. So in brief and in summary, because of maybe we can go into some discussion with that afterwards, and related to what your first statement and your first question, the current situation, the current status of the rapid antigen test don't recommend them to be used as a screening, as a systematic testing for passengers.
Thanks for that, Josep. And now, if I turn to you, Luc, from looking at the industry as a whole and the different options open to us, what's your view on testing and the role of that alongside the other measures?
Yeah, the testing is coming as an additional layer in the risk mitigation actions to be taken by industry. So the testing is coming on the top of it, and it's now, as very much explained by Josep, it's something which we need to work out how to implement it to get the results we expect to have, to show that traveling by air is still safe, but also that bringing forward travel capacities will not bring also cases outside the countries we are coming from, and that is where the testing is important. The cursor is not yet set exactly. We don't know exactly where we put the cursor in terms of massive testing or no testing. I think Josep was extremely clear on that. We are in the middle of a discussion with them. ECDC is our reference, if you want, authority to tell us what will be the best in order to avoid false positive, false negative, bringing wrong decisions by the operators. We don't want to have denied boarding without having a solid indication what is appropriate to base or the decision on. And that is very important. So an additional element to continue to improve the situation. We are still in the middle of the negotiation with ECDC, and the discussions with Josep colleagues and EASA colleagues are really intense those days in order to get maybe a testing protocol because the mandate has been issued to ECDC and EASA 2 weeks ago, so we've been asked to deliver a proposal for a testing protocol around mid of November. So we have still a few days, but not too many. I think our colleagues from the Airlines would like to have it today. We do all our best in order to get it ready in due time, but it must be proven scientifically based. And we are really working on that today. What I want to say as well, this testing experience might be also profitable, of course, to the other transport modes. And this is something also we need to take into account in order to extend the benefits of our experience outside aviation.
Thanks for that. And I think hopefully I know we've had quite a few questions about the timescales there already, and I think it's good. I think the audience would probably really pleased to hear that there's work immediately going on now, and that at least there will be proposals in the coming weeks, and the work will evolve in terms of how testing integrates as part of all the multifacets of all the different measures with the existing health safety protocol, the contact tracing and the tracing afterwards, and the improvement of that process through the passenger locator card and the standardization of that approach. So perhaps now it's a good time to turn to Stanislav from the airline perspective, and it feels like a bit of a rhetorical question to say, do you see testing as a key part of the solution for airlines, but more, how do you see it from the airline perspective, Stanislav?
Yeah, we see it as a potential way forward for bringing passengers back, as it looks to us at least. But with some conditions. I listed for myself 4 conditions that would be workable to make the test sufficient. It should be some kind of a fast test that really can be done within 10 or 15 minutes, so right before the flight, and give the explicit result. It shall be relatively simple, so it shouldn't be causing additional complication for us. So it should be kind of a breath test or any kind of a simple test, whatever industry would propose to us, because I don't think that blood test, for example, is doable in the airport environment. Even the swab test would be probably not that easy to achieve. However, we know that it's done in certain locations. We also think that it should be done in the airport, like right before a flight, rather than demanding from the passenger to bring the test from a certain approved laboratory, because it would bring again a lot of complexity on the airline staff or on the handling agent, because they would need to verify or validate the quality or the validity, or if it's if it's a proper test or not. So if it's done right on site, it would be much better. Third point, it shall be affordable. The cost of it, we never considered, I guess, in this discussion. The test costs money, and in some countries, tests can cost up to 80 euro. So buying ticket for 20 euro on low-cost airline and then paying 80 euro for the test, I think it's a good package overall. So there shall be a low-cost test, obviously. And the main one, the test, if it's implemented, it should be an ultimate solution and substitution to flight restrictions. There shall be no room for additional conditions. If the test is negative, passenger can fly. So something shall be accepted on the European level. If we go forward with the testing, then the restrictions shall be replaced with a traffic light system. If the passenger got a negative test, he's free to fly, he's safe to fly, the environment considered to be safe. Because otherwise, again, it's more and more complexity to the system. So if it's implemented in a smart way, like I listed above, in current circumstances, it probably will be one of the best measures to return flights to the skies.
Fantastic. Thanks for that answer. Yeah, that was really good to hear your point of view there. Now, if I can turn to Ivan. Now, I know at Aeroporti di Roma, you've implemented testing on arrival for a number of countries now seen as higher risk, and you've also had a pilot project testing passengers before departure for 2 selected flights on a daily basis. So what lessons have you learned from that, and do you see such a project taking place without the involvement of health authorities, and what's your view on the situation, Ivan? Thanks.
Correct, John. Just to share a few more details, we have started at the airport testing activities on arriving passengers mid-August under the order of the Ministry of Health. And this is a joint operation. The health part is under the responsibility of the region, Lazio, the regional health authorities. And they decided in August, I mean, the Italian government and the regional government decided in August and again in September that for screening large volumes of passengers at airport premises and also outside airports, rapid antigen test was the most suitable option. We have another very large screening operations, testing operations going on at the airport. The first one is in the terminal and mainly for arrival passengers, but in September we also started the pilot, as you mentioned, on the Rome-Milan route. We have another large operation outside the terminal. This is a drive-through facility, something like 15,000 square meters with 8 testing lanes, and this is open to the communities living around the airport, and this is both PCR, molecular, and rapid antigen according to the different needs of the patients / passengers. These are very big operations, again, decided by the health authorities as an appropriate means, appropriate countermeasures to slow down or stop the circulation of the virus. Of course, as an airport, we do not have the competence to say if this is the right decision or the wrong decision, but we observe that it did have an effect in terms of passengers that were found positive, period. Honestly, we think that this is suboptimal. We are not having passengers in aviation. It's declining again, and the outlook for the next 3-4 months are very weak. We are not having passengers in aviation because we have a system based on restrictions that are not harmonized and quarantines. We think that testing before departure has many more advantages. Testing before departures regards 100% of the passengers. They are tested negative before departing. I'm not saying molecular or antigen or both, but if you test passengers before departure, you can be sure that you actually handle 100% of the passengers entering a country. Quarantine and limitation to quarantine and testing upon arrival is based on the individual responsibility of the persons. And it's hard to guarantee the surveillance of the quarantine in hundreds, thousands, or millions of persons moving around. So we think that for the next months, this is the only viable option that can combine safety and a partial reactivation of air travel. Obviously, we think this is not a tool that is appropriate for all flights, all passengers in general. There are clear capacity limits. We have a capacity of testing at the airport with the cooperation of the regional health authorities, a capacity of 5,000 tests per day nowadays, 24 hours a day, 7 days a week. But even if we push on the capacity side, I don't think we will be able to get any close to the level of passengers that we used to have before the COVID pandemic in terms of screening capacity. We might come up with a capacity of 10,000, 15,000 if we invest a lot together with the regional health authorities on this activity. But for passengers and people arriving from red areas, orange areas, where we want to control the different levels of risk between territories, okay, this is the most appropriate tool. It is not quarantine, it is not restrictions on non-essential travel. With those restrictions, those blanket restrictions, we will not have any significant amount of passengers in the next months to come. So this is our position. I think it's a good platform, and the experience of Aeroporti di Roma and Italy in general demonstrated that it is operationally feasible. I repeat, I do not have the competencies. It's not our responsibility to evaluate properly what are the pros and cons in terms of public health protection. I just observed that this was the decision of the authority.
Thanks for that, Ivan. And I think one of the we've seen it in this panel with the four different parts of this jigsaw. With the view from ECDC and the health authorities, from EASA as an authority, and obviously we work very closely with all the national authorities around Europe and beyond European borders as well. Airlines and airports, and it's a continually evolving situation. Where there are lots of evolving technological solutions, practical solutions, and to an extent, as we've heard, political solutions that create these challenges. And I think, what we have already with the health safety protocol is that foundation that we talked about. And we've seen, particularly from what Luc and Josep were saying, the evolution of testing as an integrated part of the health safety protocol, so that, then, we know, we have, obviously, as you might imagine, different advisory bodies and the different activities that EASA does, working and understanding how, from an airline, from an airport perspective, what's practical, what's feasible, and bringing those together, those four different viewpoints, into something that can evolve and help our industry survive and help our industry grow and manage as much as we can this challenging and evolving situation. And before we go to the questions, and we had, as you might imagine, lots of really interesting ones, and we see how much we can test our panelists here. But one of the things, just perhaps quickly to sum up, I think the biggest thing that's come out of this is that that there's no single silver bullet that's going to solve this. Testing is a part of this. The passenger locator card, the passenger locator forms, the contact tracing. If there is an infection through the system, how we manage that, all of the protection of people from a physical biosecurity perspective throughout their journey, and it's particularly managing that that journey from end to end with all of these different approaches. Hopefully we can create an experience that impacts the way passengers, it provides that hopefully over time more certainty, more coordination, enables that certainty that mean people can book flights knowing more about the situation that they'll face and having less concern about that. Similarly, also from a health perspective, being able to then feel confident, it comes back to what I said at the beginning, is feel confident that when they book, they feel safe from the second that they arrive within the airport to the second they leave at the other end. And then they have this positive experience that they go home and they tell people, I flew and it was good. And ironically, even my own experiences, sharing that with people I know who've had exactly the same feeling and who've gone to book flights themselves because of positive experiences they've heard from others, and similarly, and all that kind of thing. One of the things that we've had quite a few questions about, and perhaps we could come to Stanislav first, and perhaps Ivan second, is the question of policing of the mask situation. We've had, there's been quite a few questions of that. Is how do you cope? If I come to Stanislav first, how do you cope as an airline with the policing of the mask situation on board the aircraft?
Well, masks became a new normal, a new real. We promote no mask, no fly policy. It's all over, it's on our website, it's on the placards, on the check-in. We are planning also we're still considering actually, maybe we will put some stickers on the aircraft. Most of the passengers already got used to this reality and they know that no mask, no fly. In fact, we are quite lucky comparatively probably to the airport that before reaching the aircraft, passenger already passes through the airport where he would be reminded several times that he needs to be in the mask. We have certain percentage of passengers that do not want to cope with the mask policy. So yes, we feel a growth in the trend of unruly passengers due to the mask-related disruptions. And on the second place, by the way, the disruptions related to PLC forms. So yeah, we are very strict on this. As mentioned, it's a new reality, and this is the only way to make passengers flying now. Everybody are very strong on this position. I mean, this is probably one of the most easy and efficient ways to prevent virus spreading. So we do with these passengers whatever we did with the smoking passengers once we had a trend of the smoking unruly passengers. So if passenger is disruptive, if he is not coping with the crew instructions, he end up in no-fly list at the end. And we are very, very strict on this.
Yeah, it's good to hear, and ironically, I actually have had a really positive experience from one of my family members with your own policy as an airline, and they found somebody who somebody wasn't following, and the crew acted fantastically, and they reported to me particularly. It was interesting to see, and I hear that a lot, that from lots of different people, that the airlines across Europe are handling this situation very well. We're certainly from an EASA perspective, we're continually monitoring the number of reports of unruly passengers that we get, and we appreciate, particularly for cabin crew on the aircraft, they're put in this challenging situation where they have to kind of police this situation. If I could turn perhaps to Ivan, how do you handle the situation of masks, particularly within the airport? How do you police that in such a large space? It must be a real challenge.
I think we achieved the result because it's really a very small number, a tiny number, the persons that do not use mask into the terminal. First of all, we have control of access to the terminal. The terminal is only for passengers and operators, not for meters and greeters. And you can enter the terminal from certain entrance gates. From certain entrance gates, and we check the temperature upon entrance into the terminal, and we check the wearing on the mask. Then, as part of our certification scheme, biosafety certification scheme that we got in June, we have biosafety teams with a certain jacket. Everything that we communicate related to the prevention protection measures as a single color, light blue, within Fiumicino, just to facilitate it, make communication easier of the safety measures. And we have this biosafety team patrolling the terminal and policing actually the mandatory use of the masks. And every deviation is reported because we have to according to the biosafety certification scheme. Then we have technology. For example, at the boarding gate, we repeat the measurement of the temperature, and we have technology that is able to detect if the mask is worn or it is not worn by the passengers. And there is an alarm going off if the mask is not worn. So the gate agent doesn't even have to check directly with his eyes or her eyes, because actually the machine is doing the job pretty well. And in general, a lot of communication. I repeat, I mean, we might have some cases, few units, maybe between 10 and 20 in a month of reports of persons not using the mask.
Thanks for that, Ivan. I think it's really interesting to see some of these challenges that we face, and I know, particularly the question of mass has been heavily debated, and it's a challenge that we all face across society, and not just here in, not just in the aviation community. If I maybe turn to Luc with perhaps as we head towards the end, one final question about communication. Is there are lots of things happening, and what do you think are the best ways we can communicate to the industry in terms of these measures? How can we help? Once we've had the coordination, can we do more to communicate and coordinate that? We've had a few questions about that side of things.
We never communicate enough, I think, in particular in time of crisis. I mean, the more you communicate, the better you understand how to react to the crisis. And we see even in a normal, outside the transport sector, how quickly sometimes decisions must be taken to mitigate the risk of contamination. Traveling by air is not an exception, so there are measures which must be explained properly to be implemented properly. So there is one communication is to the society to get the confidence needed to be seen that, I mean, we do all appropriate measures, that traveling by air is safe, but communicating also to the passengers who have to board, who have to check in, who have to behave properly in the cabin when they are recovering the luggage. It's where we do not do enough. And the agency, when it has adopted with ECDC the protocol, prepared a lot of material in all languages of the EU, and dispatch this material in order to reach the target, is to get the passengers properly informed in his language what is expected to do as on its own. And it was said by one of our previous interlocutor, I mean, we depend on them to implement the measures. So the communication is key to ensure that we are seen as implementing, but also to have the proper implementation. And last but not least, to be sure also that they know what they have to do in order to behave properly. So I think it's really the most important element. And this conference today and tomorrow is certainly another occasion to amplify the message and to show that health is also part of aviation and air traveling today, and should be part of our DNA, if I can say so, of the passenger.
Yeah, and I think that kind of summarizes things quite nicely to round off the session there, is that, ultimately what we're looking for, and we talk a lot from a safety perspective in terms of a performance-based approach. But I think, in terms of the health safety side of things as well, is that, we know, what that passenger experience should look like. And I know, the coordination between EASA and ECDC, the collaboration with industry is all centered around, how can we create the conditions where passengers can feel confident, where there are standard approaches and measures as much as we can achieve with a continually changing situation, that we build this confidence and that we continue to apply these measures and hopefully find a way to enable our industry to move forward and survive and meet the challenges that we face in this period. I'd like to particularly thank the four panelists for their contributions. Hopefully it was interesting to all of you in the audience. It was great to get these different perspectives and viewpoints in the discussion. Particularly thanks to all of the audience members who took the trouble to ask questions. Obviously with such a large audience, it was really hard to kind of be able to pick enough out, and obviously in such the period of time that we had. So thanks for all your contributions, and particularly useful to all of us involved in trying to solve these challenges together to understand what the industry is trying to do. So thanks to everyone. Hopefully you found that interesting, and now I'll hand it back to Janet so we conclude the first day of the conference. Thank you.
Thank you.
Thank you.
So thank you very much, John, and Luc as well in the studio here at EASA, and thank you very much to the panelists who were contributing from elsewhere. As John said, we're now reaching the end of our first day of the conference here. We just have one final segment. I'd like to hand over to our Head of Aviation Safety Intelligence, Eric Fernandez, who will now wrap up today for us and look ahead a little bit to tomorrow. Thank you very much.
Thank you, Janet. So we have reached the end of day one of this very peculiar EASA Annual Safety Conference. Peculiar because it's the first time ever we run it fully virtual and in such testing time for all of us. So many thanks to all of the discussions. I think we had a pretty rich day. We had the keynote addresses of Patrick Key and Johann Friedrich Kolzmann, the Director General of the German Civil Aviation Authority, who put some perspective on these times where we live on, what the pandemic has done to our societies and to the aviation sector in particular. We also had the keynote speech of Johan van Est, the President and CEO of the Cologne-Bonn Airport, who shared with us some insight of what an airport has to do to cope with this new reality situation. Then we had two panels today, one on safety and one that just finished on the health safety. So on the safety aspects, what we could discuss is how the pandemic has shaken up our operational landscape and consequently the safety landscape, how we have reacted in our diversity, be it an operator, a manufacturer, the ATM, and so on and so forth, authorities, also the European Commission, the legislators. And I think a key takeaway from those discussions was that it reinforced the importance that the safety management systems had before and will have even today in this new reality. And also, as an immediate action, the importance to reevaluate our risk register. And the poll we did seems to indicate that many organizations indeed have done it. On the aviation health safety protocol, we discussed how to keep our passengers and the aviation personnel safe from the virus and to promote the aviation as a safe form of travel. We have also, in this discussion, seen the difficulty that the industry, in particular the airports and the operators, who are the front line in this, face, along with our passengers, to cope with the diversity of the restrictions and the limits to travel from one country to the other. So tomorrow, we'll have more discussions on three very current topics. We'll have a short talk with John Franklin, that you just saw now, on how to take care of the well-being of ourselves, of all the aviation staff in the industry. Then we'll have a panel on how to recover greener. The environment was already a big topic for us as a sector, and with this current situation, we know that there are very high expectations that we'll recover even greener. So we'll discuss that tomorrow. And finally, I will come back, standing in front of you, to introduce to you the Data for Safety program, along with our members. The first time we will go really public, showing what we've done with this program, which will bring a lot of valuable capabilities in terms of safety intelligence. And in the current times, I believe it's even more relevant. So with that, I hope you appreciated the discussions, that you will come back tomorrow. We will start at 9:30, registration at 9. In the meantime, I wish you a good evening, and I thank you very much.